This is Christine Porter with the Times News. I'm here today with Daniele Shollenberger, a nurse practitioner and director of the Concussion and Head Trauma Program at Lehigh Valley Health Network. We are talking about serious symptoms of a concussion.
Loss of consciousness is very important, and that person, if they have had loss of consciousness any age, needs to be assessed by a medical provider. And we say an ER or an urgent care at this point when we're speaking about what is dangerous or serious. Also, vomiting, that always warrants a medical evaluation, more or less immediate. And if people are feeling confused or a loved one notices that they are confused or their behavior is different, if their speech is different. So you also probably have heard, the patient became more sleepy. After they hit their head, they started to seem more sleepy or just were, difficult to keep awake. Those are the most serious symptoms that need to be evaluated in an express care, an urgent care, or an emergency room.
About loss of consciousness, what about that makes it so serious?
So loss of consciousness, I'll just tell you that 20 plus years ago, we graded your concussion on how long you were unconscious. And now we know that less than 10% in, for example, sports, less than 10% of patients will have loss of consciousness. So we can't just go on that anymore like we used to, because clearly that may not be indicative of what's going on. But if there is loss of consciousness, what we're worried about is there hemorrhage in the brain or a skull fracture or something that's more emergent, something that needs treatment immediately. And I like to say this as well, that concussions they don't have one specific test. So that's what makes them difficult to assess. And for the CDC to say that sports concussions, for example, are one of the most difficult diagnoses to make because there is not one diagnostic test or one lab result, one blood test that's going to say, oh my goodness, that's a concussion. And in fact, if you do have a CAT scan and your provider says it's negative, that means there's no blood, meaning hemorrhage, and there's no fracture. However, if you still have symptoms, that actually validates that you do have a concussion.
Does where a person gets hit or their head hits, affect what type of a symptom they might have?
Yes. So for example, the frontal part of our brains is where we have personality and some parts of memory. And so if you just get a blow to that area, you may have more symptoms where you have memory loss or change in personality, mood changes, more or less. So men will say they're crying and they don't ever cry. And, you might hear that certain people, male and female, are more angry or easily frustrated. Hitting the back of the head, that's where our vision is interpreted. And often we see more visual changes. Patients may report blurred vision. Additionally, balance center can be affected back there. But I have to also show you with my hands that many times with an injury, you're going to hit this way, hit the front, and the brain can actually impact other parts of the brain, even though you feel like you've only impacted one segment. So that's why we assess for all of the brain function symptoms.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.